My name is Daniela Rossi. I'm a clinical psychologist and I work at private therapy clinic. My main areas of expertise are childhood and adult trauma, psychosis, bipolar disorder, and personality disorders, especially borderline types. Working with this clinical presentation, however they may seem different from one another, I think that we can identify themes underlying them and therefore leading the intervention in clinical terms. Broadly, we can divide the area of intervention in three main categories. One is personal area, the other one is a relational area and an emotional area. In terms of personal area, we will be looking at, for example, improving people's self-esteem and self-confidence. Sometimes it's about working with a fragmentation of self, so poor gender identity or sexual dysphoria. It could be poor body image coming across, for example, in problematic such as eating disorders. When we look at the relational area of an individual, we will be looking at, for example, helping the individual to build up and sustain long-term relationships, developing interpersonal skills. When we look at the emotional area, we will be looking at intervention around improving distress tolerance and emotional regulation skills. When somebody comes to see me, I will greet the person, introducing myself, and we will start a process called assessment. This process may take between 1 or 2 sessions, depend on the type of difficulty the client will bring in the session. Basically allowed us to gather a narrative around the problem, what the consequence of the client's problem is having upon life, and also what may be maintaining these problems. Also, the assessment will allow me to have a bit of understanding of the client's background history, social circumstances, and also expectation for therapy. A good practitioner is somebody who is able to make client feeling safe and secure, first of all, as somebody who is able to listen and pay attention carefully to what clients say and how does he say, certain things. Also, it's important to be able to be mindful, to be able to observe client behaviors, non-verbal behavior. It's good to to have fun in therapy and to use humor when it's appropriate. It's important to have a client on our side and having a joint venture. Therapy in fact is a joint venture of 2 individuals, supporting one another and developing skills and knowledge from these relationships. Having psychological difficulties is definitely a common experience among human beings, because all of us at one point in our life will go through a difficult experience, which will inevitably trigger difficult emotions, for example, sadness, anger, remorse, guilt. All of us will have to face situations in life that are inevitable, such as maybe losing somebody to death or separating, and losing our look, growing older. So all these existential themes are bound to provoke difficult emotions and difficult experience, and people have different way of coping with those issues. But having said that, we are all bound at one point in life to go, across a difficult period in our life.